If you're looking to really cut through all the noise and understand what's going on with menopause symptoms, I mean, the common stuff like hot flashes, but also those less talked about things like weird skin sensations, then you are definitely in the right place. Your mission today, to get a fast but really thorough grasp of this whole experience. And we're using just one key source to guide us. Okay, let's unpack this. We're basing everything on the 2021 Korean Medicine Clinical Practice Guideline for Climacteric and Postmenopausal Syndrome. We'll call it GCOM. Now, this isn't just some list of problems. It's huge, and it gives us a real roadmap, symptoms, treatments, all within Korean medicine.
Yeah, and that structure is really key here. What the guideline does so well is help you see the difference between, say, changes happening right around your last period versus the longer-term health shifts that can happen years down the line. It gives everyone, patients, practitioners, a much clearer picture of when to expect certain things. And that, well, that makes managing it all much, much better.
That structure sounds vital. So instead of just this big umbrella term menopause, the guideline actually breaks it down, like chapters.
Exactly. 3 distinct phases: initial or acute, then midterm or subacute, and finally late or chronic.
Okay, let's start at the beginning then. The initial acute symptoms.
Right. These are often the first things people notice, kind of kicking off during that perimenopause transition. And yeah, the most recognized ones are what they call vascular or vasomotor symptoms.
Wow.
Basically, your internal thermostat going haywire.
We all know the textbook one, right?
Mm-hmm.
Hot flashes and Mayan Hongjo, I think is the term.
Yeah.
And that feeling of heat rushing to your face and chest.
Mm-hmm.
But you mentioned haywire. Does it swing the other way too? Because that often catches people off guard.
It absolutely does. And the guideline points this out. You see these unexpected things like really cold hands and feet, sometimes heart palpitations, almost like a fluttering, even shortness of breath. Your body's just struggling to find that stable temperature. So including these cold symptoms alongside the hot ones really shows it's a system-wide stability issue, not just heat.
That makes sense. It's not just one thing. What else happens in this early phase?
Well, there's a pretty heavy burden on the nervous system and the musculoskeletal system too. So you get the insomnia. Lots of people experience anxiety, that feeling of restlessness, can't sit still. But also really concrete physical things: low back pain, shoulder stiffness, general joint pain. And all of this together often leads to this profound feeling of just fatigue, lethargy, weakness.
Really, that exhaustion people talk about.
Yeah.
So, okay, that covers the immediate, often kind of fiery start. But it doesn't just stop there, does it? What about these midterm or subacute symptoms?
Yeah, this is where things shift a bit. We start seeing issues related to atrophy tissues thinning or drying out, and some of those more, let's say, hidden sensory things that can really impact quality of life. The midterm really focuses on the skin, nerve endings, and the urogenital system.
Okay, so skin changes, like dryness.
Yes, skin dryness is common. Also tingling or numbness, often in the hands and feet. But the one that really surprises people, though it's medically documented, is formication.
Formy what, man?
Formication. It's this feeling, this sensation of insects creeping or crawling on your skin.
Oh, wow. That sounds incredibly unnerving. And like something you might not connect to menopause at all. Maybe you'd think it was something else entirely.
Exactly. It's a real symptom, though, linked to nerve and tissue changes. And this midterm phase is also where the urogenital symptoms, driven by lower estrogen, really come to the forefront. So that means things like vaginal dryness, which can lead to pain during intercourse, and often a noticeable drop in libido.
And the urinary issues, too, I imagine. Those seem to come up a lot in conversations.
Definitely. Frequent urination, maybe feeling like you have to go right now, which is overactive bladder, and sometimes urinary incontinence, leaking.
Yeah. And those aren't small things, are they? They could really change your whole day, make you anxious about going out.
They have a huge impact.
Absolutely.
And finally, just briefly, the guideline outlines the late chronic symptoms. These are the longer-term health risks that tend to increase after menopause. We're talking about a higher risk for cardiovascular disease, osteoporosis, bone thinning, high cholesterol, and changes in body fat distribution.
Okay, that paints a really clear timeline. Acute changes, then atrophy and sensory issues, and finally these longer-term risks. But knowing the map is one thing. What about navigating it? Let's talk management. Before we dive into the treatments in the GCOM guideline, though, maybe we should quickly touch on how they rate the evidence. You mentioned grades before.
Oh, yes, that's essential. Good point. The guideline is rigorous about this. So when we say grade A, that's the highest level. It means the recommendation is really strong, backed by good quality, consistent clinical trials.
Okay. Solid evidence.
Right. Grade B means the evidence is still supportive, but maybe it comes from fewer trials or they weren't as high quality. The certainty is lower, but it still points towards effectiveness.
Got it.
And then you have GPP good practice points, or CTB, consensus of the treatment board. That basically means it's based on strong agreement among clinical experts, even if large trials are lacking. It tells you not just what might work, but how confident the experts are based on the research.
Perfect. That context is super helpful. Okay, so with that framework, let's talk solutions. Starting with, well, the biggest offender, right?
Yeah.
Hot flashes. The guideline mentioned that practitioners see this most.
By far. Almost two-thirds, 65.75% of the surveyed Korean medicine practitioners said hot flashes were the top complaint they managed. And for hot flashes, the guideline gives a really strong endorsement to acupuncture.
Okay.
The evidence supporting acupuncture to reduce hot flashes when compared to like a placebo treatment or just standard care is grade A, high certainty.
Wow, grade A. So that's not just a maybe. That's proven.
It's a solid, proven intervention based on the clinical trial data reviewed.
And does the guideline get specific, like how acupuncture helps?
It does mention common acupoints, use things like GV20, CV17, CV4, LI4. For anyone listening who's new to this, these points are often chosen for their role in, well, regulating heat, calming the nervous system, or strengthening the body's overall energy balance.
So it's not just poking needles anywhere, it's targeting specific pathways related to the problem.
Exactly. It's about addressing the underlying path, the disharmony that's causing that thermal chaos. Now, the guideline also looks at electroacupuncture, EA.
That's with the mild electrical stimulation added to the needles.
Correct. And it highlights EA as having comparable effects to hormone replacement therapy, HRT for general menopausal symptoms, but potentially with less risk. That gets a below recommendation.
Comparable effects to HRT, but less risky. That blow rating is really interesting then. It means even if the certainty is a bit lower than grade A, the practical outcome similar benefit, fewer worries makes it a really attractive option for women who are hesitant about hormones.
It definitely presents a powerful risk-benefit consideration for many.
Absolutely.
Now, shifting gears slightly, let's talk herbal medicine, or hanyak.
Okay.
The guideline points to several specific formulas that have shown effectiveness for hot flashes. For example, Gajibung Yongwan is mentioned.
Right.
And that's a formula traditionally used to help with blood circulation, reduce stagnation, things often linked to heat patterns in Korean medicine.
Ah, okay. So the complex names actually relate to how they're believed to work on the body's systems.
Precisely. And another really important finding relates to formulas like Gami Soyosan. This one is often considered when hot flashes come alongside significant emotional symptoms like anxiety, irritability, mood swings, that kind of picture.
Well, that's a common combination, isn't it? The heat and the emotional roller coaster.
Very common. And the guideline found that certain formulas, including this Gami Soyosan, showed effects that were comparable to conventional treatments like SSRIs, the antidepressants, or even HRT. It gets a blow rating for that comparison.
That is really crucial information. So if someone is dealing with both the heat and significant emotional distress, and maybe they want to avoid HRT or antidepressants or have had side effects, these specific herbal formulas offer a researched alternative path.
It gives another well-evidenced option, yes. And sometimes the approach is even simpler.
How say?
The guideline also includes what it calls therapeutic regimen advice, basically lifestyle or diet. It specifically recommends considering soy and soy-derived foods in the diet to help alleviate hot flashes. That's based on blow evidence.
Soy. Interesting. So a simple dietary addition could potentially make a difference.
It's presented as something to consider, likely due to the mild phytoestrogenic effects of soy. It's an accessible first step someone could take. Okay, so moving on from hot flashes, let's revisit those midterm symptoms that really affect day-to-day life, specifically the urinary symptoms we touched on, the frequency, the urgency, the incontinence. These have such a big impact.
Yeah, definitely quality of life issues.
Yeah.
I might have assumed treatments would be more behavioral, like exercises, but you mentioned acupuncture earlier.
Yes, the guideline does recommend acupuncture for frequent urination and overactive bladder. That's based on strong expert consensus GPP-CTB.
Okay.
But where the evidence really gets interesting is in combining therapies, especially for functional problems like stress, incontinence, leaking when you cough or laugh, that kind of thing.
Mm-hmm.
For postmenopausal stress incontinence, the guideline suggests that combining electroacupuncture with specific herbal medicine, often formulas aimed at strengthening the body's core energy, like Bojun urogenital, maybe customized could actually be more effective than just doing Kegel exercises alone. That's a blow recommendation.
Wow, more effective than Kegel's alone. That highlights a real holistic approach, doesn't it? Using the EA maybe for the muscles and the herbs for the underlying energy or tissue health.
Exactly. It's synergy, tackling the problem from multiple angles. And that combined approach seems key for vaginal atrophy, too.
Right, the dryness and related issues.
Absolutely. Atrophy can be tough because it often tends to worsen over time if not managed. The guideline discusses specific herbal treatments, mentioning formulas like Wangrianagyo Tangaganbang. Now, the research reviewed suggests these specific Korean medicine herbal treatments for atrophic vaginitis can sometimes be comparable or even potentially superior to complex conventional treatments involving hormones and antiprotozoal drugs. That gets below or clow evidence grades depending on the specific study.
So again, it's not just an alternative, but potentially a really effective one, standing toe-to-toe with standard medical protocols for these specific, often distressing symptoms.
That's what the evidence suggests. And importantly, it's not necessarily an either-or situation.
What do you mean?
The guideline also notes that combining Korean medicine herbal therapy with conventional HRT might actually be more effective for treating atrophic vaginitis than using HRT by itself.
Ah, so they can work together. That's huge for someone trying to figure out their options. They could potentially integrate both approaches.
Precisely. It suggests these treatments aren't mutually exclusive. They can be complementary, potentially offering enhanced benefits together. That flexibility is a really important takeaway. And, it's easy sometimes for symptoms like that crawling skin sensation, formication to be dismissed, or for the focus to just be on heat. But the way this guideline meticulously includes these sensory details, the urogenital changes, it really validates the full scope of what women experience. It acknowledges how these physical changes deeply affect daily life, mental well-being, everything.
This has been incredibly insightful. We've really unpacked how complex menopause symptoms are, moving from those acute flashes and chills to the midterm atrophy and sensory changes, and then the long-term health considerations. And it all evolves over time.
Yes. And to sum up the management side from the guideline, it strongly confirms there are diverse, evidence-based options within Korean medicine. You've got acupuncture with high certainty for hot flashes, specific herbal formulas carefully matched to individual patterns, even dietary advice like soy. These offer robust choices, especially important when conventional HRT isn't suitable, maybe due to risks, or if someone experiences side effects they can't tolerate. This really raises an important question. We talked about the timeline, how some symptoms like atrophy worsen with age and hot flashes. Well, they can last for over a decade for some women. 13 years or more isn't uncommon.
A decade, wow.
So considering this and the range of effective management strategies we've discussed, the acupuncture, the herbs, the combined therapies, how does knowing these options exist maybe change your perspective on choice? The fact that sustained, tailored management is possible beyond just sort of gritting your teeth and writing it out seems crucial.
That's a powerful point. It's not just something to endure. Okay, so think about this whole deep dive. The wide range of symptoms, from vasomotor to urinary to sensory, and these very treatments, acupuncture, herbs, diet. What single symptom or approach we detail today feels most relevant to your own health awareness right now? And based on that, what further research might you want to prioritize next? We'll leave that provocative thought with you. Until next time.